India's universal immunization program, it's a true public health giant. I mean, it saved millions of lives from diseases like measles, and it even wiped out polio. But here's the thing about success. It brings new challenges. As India's whole health landscape shifts, we have to ask a really important question. What's the next big shot we need to take?
And look, right now, there's a really strong debate happening about adding the typhoid vaccine to the program. And honestly, it's for some very good reasons. But what if there's another disease out there, a kind of silent threat that's been growing in the background, one that might actually deserve our attention even more urgently? Well, today, that's what we're diving into, the powerful case for prioritizing hepatitis A. Okay, so this is where the story gets a little, well, counterintuitive. For decades, hepatitis A in India was just not a big deal. It was a mild illness kids got, and because pretty much everyone was exposed early on, they were fine. But here's the paradox. As our sanitation and hygiene have gotten better, which is a huge win, right? Fewer and fewer children are getting that early exposure. And that amazing victory has, weirdly enough, created a brand new vulnerability.
So just look at the difference here. The whole identity of hepatitis A has completely flipped. In the past, it was a mild childhood bug that gave you lifelong immunity. No big deal. But today, for unprotected adolescents and adults, it's a severe disease. We're talking about something that can cause acute liver failure, and yes, even death. It's a totally different beast now.
So what this all boils down to is pretty simple. That natural protective shield that used to cover almost the entire population, it's just disappearing. And what's left is this huge, growing immunity gap.
And just how big is this gap? Well, the numbers are pretty stark. If you go back 2 decades, more than 90% of the population had those protective antibodies. But today, in a lot of our urban areas, that number has plummeted to less than 60%. And look, this isn't just a statistic on a chart. It's a growing pool of vulnerable people. And it's exactly why we're starting to see serious outbreaks in places like Kerala and Maharashtra.
All right, so we've established that hepatitis A is a real and growing threat. The next logical question is, how does it actually stack up against typhoid, the other big vaccine being considered? Let's put them side by side and see.
Okay, this table really breaks it down for us. I want you to notice a couple of really critical differences here. First, treatment. For typhoid, we have antibiotics. They work. But for hepatitis A, there's nothing. No specific cure, just supportive care. Now, let's look at the vaccines themselves. The Hep A vaccine gives you incredibly long-lasting immunity. We're talking 15, 20 years, maybe more. And get this, India has had its own safe, homegrown version for over 2 decades.
So, when you start laying out all the facts, how effective the vaccine is, how long it lasts, the fact that the disease has no cure, the balance really starts to tilt. And it tilts pretty decisively in one direction.
I mean, let's just run through the checklist for what you'd want in an ideal vaccine candidate. Does it offer amazing protection, like over 95%? Yep. Does the immunity last for decades, maybe even your whole life? Check. Can a single dose be enough? Yes. Does it target a disease that we have no other cure for? Double check. And on top of all that, we have a safe, effective, homegrown vaccine that's ready to roll.
One expert really hit the nail on the head. They called this the low-hanging fruit of vaccine-preventable diseases. And that's just a perfect way to put it, isn't it? When you've got such a clear problem and such a perfect solution just sitting there, it's a huge public health win that's right there for the taking. Now, I want to be super clear about something here. This isn't an argument against the typhoid vaccine. Not at all. It's an argument about being smart, about being strategic. It's a plea for rational sequencing. It's about asking, what is the most logical, most impactful move we can make with our resources right now?
Okay, so if we were to do this, how would it actually work on the ground? Well, the best part is we don't need to reinvent the wheel here. There's already a clear, practical, and phased-out plan for how to do this.
And the strategy is just really logical. Step 1, you start where the need is greatest. You target the states that are already having outbreaks or where we know immunity is low. Step 2, you just piggyback on what's already there. You co-administer the shot with existing boosters, so you're using the infrastructure we've already built. No need for a whole new system. And finally, you track everything with surveys to guide how and where you expand next. It's all based on data.
So when you put all these pieces together, adding the hepatitis A vaccine to the program isn't some radical new idea. It's just the natural next step. It's a logical evolution that perfectly continues the program's long history of making smart, forward-thinking decisions to protect the health of the nation.
And really, this whole discussion points to a much bigger truth, doesn't it? Public health is never static, it's always changing. As diseases evolve, our strategies have to evolve right along with them. The real challenge, then, isn't just about celebrating the amazing victories of the past. It's about staying on our toes, constantly adapting to new threats. And that leaves us with a final, big question. How do we make sure our public health priorities are always evolving to meet our changing reality?